Hello, my name is Laken and I'm a family nurse practitioner student at Eastern Kentucky University. Today I'm going to be discussing an integrative review that focused on smoking among adults with underlying chronic illnesses. The CDC reports that chronic disease is the leading cause of death and disability among adults in the United States. Unhealthy lifestyle choices such as smoking contribute to these patients' early demise and can vastly decrease their quality of life. This makes smoking cessation essential in this patient population. Despite this desperate need, usual care for smoking cessation provided by healthcare providers such as APRNs has not been shown to be very successful. In the year 2015, the CDC reported 55.3% of men and 55.6% of women attempted to stop smoking. However, only 7.2% of the men and 7.6% of the women were actually successful. Out of these patients, about half of the men and half of the women sought out a healthcare provider's advice for a solution to stop smoking. This statistic is very important because it shows us that patients are seeking out help from healthcare providers to stop smoking. However, the help that they are being given is not yielding positive patient results. This is a gap in the care that would prompt an APRN to search the literature for an evidence-based intervention that would yield positive patient results for this patient population. A literature search was performed and 10 studies total were found that were applicable to the problem and the target population. 2 of these studies were examined and evaluated to study the intervention of motivational interviewing for smoking cessation. In the first study, a quasi-experimental design was performed to determine if motivational interviewing performed by trained psych nurses was successful in smoking cessation among patients admitted to a cardiac rehab facility. All participants in this study had some form of underlying chronic cardiac illness and had recently been discharged from the hospital post-cardiac event. Participants were randomized to a control and an intervention group. In the control group, participants received a single advice session on tobacco dependence treatment. In the intervention group, participants received 12 motivational interviewing sessions for 1 hour apiece and 2 weeks of follow-up. The authors used the Fagerstrom test for nicotine dependence and patient report or questionnaires to measure their data. Their data showed that 91.6% of participants in the intervention group reported very low nicotine dependence during post-intervention and follow-up periods than in the control group. The intervention group also had greater smoking cessation rates than the control group, with a p-value of less than 0.001 and a chi-square value of 140.862. Authors concluded that using motivational interviewing techniques not only encourages patients to quit smoking, but it can also increase their self-efficacy. In the second study, a randomized control trial was performed to determine if a brief motivational interviewing session by a lay healthcare worker in a tuberculosis clinic was more successful than standard smoking cessation education by a tuberculosis nurse in increasing smoking abstinence rates. All participants in this study had some form of underlying chronic respiratory illness. 409 participants were randomized into an intervention or control group. However, follow-up in the study was not blinded. The intervention group received 1 motivational interviewing session, in addition to a standardized smoking cessation message from a tuberculosis nurse and a smoking cessation booklet. The control group received the same care, except for the motivational interviewing session. These authors actually used biochemically verified quit rates and patient report or questionnaires to measure their data. The results of the study showed that self-reported 3 and 6 month abstinence rates, as well as the biochemically verified quit rates, were higher at 3 and 6 months in the intervention group when compared to the control group. Authors concluded that a brief motivational interviewing session, in addition to usual care, increased smoking cessation rates among this patient population. These studies can be used to improve advanced nursing practice because they both show an evidence-based intervention that yields positive patient results. Motivational interviewing in place of or in addition to usual smoking cessation care could decrease smoking rates among adults with underlying chronic illnesses. I believe that implementing this intervention into the primary care setting could help APRNs reach out to the greatest number of patients. Patients with chronic illness often seek care from the primary care office at least once a year. During this yearly visit, APRNs could screen patients for smoking, implement motivational interviewing for smoking cessation when warranted, and schedule appropriate follow-up appointments as needed to ensure that these patients are being successful with cessation attempts. In conclusion, APRN should be using evidence-based intervention interventions in their everyday care to improve patient outcomes. Adults with underlying chronic illnesses who continue to smoke need a strong evidence-based intervention to assist them in being successful with smoking cessation attempts. This will increase their quality of life and delay death. The 2 studies in this integrative review found motivational interviewing to be a successful, evidence-based intervention that's also cost-effective for this patient population. Thank you for taking the time to listen to this presentation. If you have any questions, please feel free to email me.